The vertical jump test is a test of lower body power. I'm going to explain the test procedures to the subject, perform screening of health risks, and obtain informed consent. Then I'll prepare forms and record basic information such as age, height, body weight, gender, and the test conditions. Then the client will perform an appropriate warm-up. To perform this test, the person stands side onto a wall and reaches up with the hand closest to the wall. Keeping the feet flat on the ground, the point of the fingertips is marked or recorded. This is called the standing reach. The person then puts chalk on their fingertips to mark the wall at the height of the jump. The person will stand away from the wall and jump vertically as high as possible using both arms and legs to assist in projecting the body upwards. Attempt to touch the wall at the highest point of the jump. The difference in distance between the standing reach height and the jump height is the score. The best of 3 attempts is reported. If the athlete deviates too far from the landing spot, then the result should be disregarded and the jump should be repeated. The athlete's jump height can be affected by a multitude of factors, such as shoulder range of motion, fatigue, motivation, displacement from the takeoff point, single or double arm swing, and placement of the non-dominant hand if a single arm swing is used. Once I get the results, I will interpret them and explain them to the athlete. For example, if I were to get 20 inches, that would be in the rating very good for a female of my height, weight, and age. The agility T-test is a test that is commonly used to assess an athlete's agility. It is performed on a safe and consistent surface to ensure that test-retest reliability is high. Besides testing an individual's ability to move in all directions as quickly as possible, it also tests a combination of leg power, leg speed, and agility for performance. The materials that you'll need is a flat surface, a measuring tape, 4 cones, and a stopwatch. So after explaining the purpose of the T-test, I will describe and demonstrate the proper route and technique. I'm going to allow the client to warm up and perform a few practice trials before administering the test. The goal of the test is to complete the course as quickly as possible. The client must keep his or her body facing forward at all times and must physically touch each cone with the correct hand. The client shuffles through the course and cannot allow the feet to cross over at any time. Proper technique must be followed or the test run will not count. So the client will start on cone A, run out to cone B, touch with left hand, shuffle to the right, touch with right hand, shuffle to the left, touch with left hand, shuffle to the center, touch with left, shuffle back. The stopwatch will stop as soon as the client will pass cone A. And the trial will not be counted if the subject crosses one foot in front of the other while shuffling, fails to touch the base of the cones, or fails to face forward throughout the test. I'll take the best time of 3 successful trials to the nearest 0.1 second. The norms for a female, if they complete this less than 10 seconds, 10.50 seconds, that is excellent, or 10.51 to 11.5 is good. 11.51 to 12.5 is average, and anything greater than 12.5 is considered poor. The power clean exercises focuses primarily on your glutes, hamstrings, quadriceps, calves, shoulders, and lower back. And to a lesser extent, it will also work the triceps, upper back, and abdominals. During the first pull and transition phase, the posterior chain, hamstring, glutes, and lower back is strongly activated, while during the extension of the second pull and during the catch phase, the anterior chain, the quadriceps, is strongly activated. The motions that each joint performs is hip extension, knee extension, ankle plantar flexion, shoulder abduction flexion external rotation, scapular and clavicle elevation and upward rotation, and elbow flexion. The power clean trains triple extension, which is your ankles, knees, and hip joints must extend simultaneously. This is a key movement for athletic performance. The exercise also recruits fast twitch muscle fibers, which generate the greatest force and speed. You're going to begin with the bar on the floor positioned close to your shins over your shoelaces. Stand with your feet hip-width apart, reach down and grab the bar with an overhand shoulder-width grip. You're going to sit your butt down and stick your chest up. Pull your shoulder blades down and back and tighten your core and look straight ahead. For the first pull, you're going to pull the bar off the floor by powerfully extending your hips, making sure to keep your back flat and your chest up. For the scoop and second pull, once the bar is above your knees, shift your torso to a vertical position and rebend your knees slightly. Now initiate the second pull, which is the most powerful portion of the movement. You're going to violently jump straight up, fully extending your hips, knees, and ankles, while simultaneously shrugging the bar with your shoulders. Keep the bar as close to your body as possible. For the catch, quickly drop into a quarter squat position with your back straight and hips and knees slightly bent. You're going to drive your elbows forward to rotate them around the bar and catch the bar in a racked position across the front of your shoulders with your fingertips under the bar. And then you're going to stand up. With the back squat, the muscles targeted are the quadriceps. The synergists are your gluteus maximus, your adductor magnus, and your soleus. The dynamic stabilizers are your hamstrings and your gastrocnemius. Stabilizers, erector spinae, and your antagonist stabilizers is your rectus abdominis and your obliques. Step 1 of the back squat is to adjust the height of the bar on the rack. The bar should be at a height that allows you to get under it, set up, and lift it off cleanly without rising onto your toes. You're going to position the bar evenly on your back and engage your muscles, creating some tension, and get under the bar. Grip the bar tightly and slide under it. Tighten your lats and pull the bar onto your back rather than just letting it sit on your back. You're going to want to maintain this tension throughout the exercise. Then you're going to lift the bar off the rack and set up for your first rep. Set your feet about shoulder width apart, take in a deep breath, and maintain tension. Stand up to lift the barbell off the rack and carefully take a few small steps backward to get into position for the exercise. Then you're going to lower into the squat. Bend your knees and your hips to lower into the squat while keeping your core tight and your back flat. Your knees should track outward directly over your toes and continue until your thighs are parallel to the ground. Then you're going to stand up out of the squat by driving through your midfoot and straightening your hips and knees to stand up. Plyometric exercises are powerful aerobic exercises used to increase your speed, endurance, and strength. They require you to exert your muscles to their maximum potential in short periods of time. An example of a low-intensity medicine ball exercise would be a medicine ball standing twist. You're going to stand holding the medicine ball in front of the body with arms bent. Place your feet wider than shoulder width apart with your knees slightly bent. Rotate your torso through the waist to one side, then to the opposite side, and repeat. You're going to start slow and gradually increase your speed. You'll perform the prescribed repetitions or for time. Besides using a heavier ball, intensity may be increased by holding the ball further away from the body. An example of a high-intensity medicine ball exercise would be a medicine ball squat and overhead throw. You're going to stand with your feet hip-width apart and hold the medicine ball with both hands in front of your upper chest or face. You're going to squat down by bending your knees and hips and immediately squat up by extending your hips, knees, and feet. Just before your legs completely extend, begin to throw the ball upward by extending your arms. Jump off the ground, straighten arms, and release ball overhead. Land on both feet with legs slightly bent to absorb impact. An example of a low-intensity plyometric jumping exercise is a lateral line hop. You're going to stand with your feet together to one side of the line on the floor, bend hips and knees slightly with your arms to your sides. You're going to jump to the opposite side of the line and land on the forefeet. Continue jumping from side to side. You're going to hop side to side as quick as possible. An example of a high-intensity plyometric jumping exercise would be a box depth jump. For this exercise, you're going to stand on the plyo box close to the front edge facing the platform. You're going to step off the box, landing on both feet between the box and the platform, and immediately jump off the ground as fast as possible onto the platform.